In this video, we'll consider opioid intoxication and opioid withdrawal. So this reduces pain and increases pleasure. Opioids are pain relief medications or pain relief drugs, which are often abused, and it's the number one cause of overdose-related mortality in the Western world. Now, when it comes to opioid intoxication, it has some systemic symptoms. So if you think of the O in opioid and think of it as a small o, it causes pinpoint pupils. Opioid drug group overall are depressors, meaning that they calm your nervous system down. They calm signal transmission. They reduce the CNS activity. They depress the CNS. They depress the respiratory system. This is why opioids are, like codeine, are occasionally used for intractable coughs. Because they can calm the respiratory system down, but too much will cause respiratory depression and too much will cause CNS depression. Now, because opioids are abused IV, that means that when you're injecting a needle, you're likely to also have more symptoms of, incidences of introducing these foreign microbes into your skin, leading to bacteremia, and that blood, which is contaminated with the bacteria, will enter the right side of the heart first, leading to right-sided endocarditis. And that's purely because of the foreign needle contamination. Now, it's also associated with HPV, HCV, HIV. Now, when it comes to the opioids, remember that these are going to cause pinpoint pupils. The pupils will be small. Low and slow are the side effects, so pupillary constriction. You'll get constipation with opioid use, reducing the GI motility. CNS depression, as we mentioned, respiratory depression, as we mentioned, these are depressors. And it will also decrease the gag reflex. Now, you're also predisposed to seizures. Now, opioids act on the mu receptors and delta and kappa receptors. The mu receptors are also where, in the previous video I told you, where methadone will act. But these mu receptors, what's exactly happening is it's stopping calcium from going out. And as it stops calcium from going it stops calcium from going into these receptors. And calcium is our main neurotransmitter for signal transmission. We need calcium to help propagate signals. And when it retains potassium, it stops potassium from going out, meaning more potassium is retained, meaning you'll have hyperpolarization, which is a more negative ion flow, more negative ion accumulation, and that's going to lead to no action potential transmission, which can produce seizures. Now, withdrawals will be the opposite. You might get dilated pupils, okay? You might get dilated pupils. Withdrawal can be, before we had reduced GI flow, now you're going to get excess diarrhea, a lot of diarrhea. And think of all essentially, this is a very gruesome way to think about it, but if you think of fluids, so they're going to be lacrimating a lot more, they're going to be crying, they're going to have rhinorrhea, which is like sniffling, and like you're going to have more stuffy nose, rhinorrhea, which is basically having a nose that's sniffling and things coming out of it, essentially. Yawning. Okay, yawning is a big one as well. So when you think of opioids with an O, think yawning. Like opioids, open your mouth, opioid, which is yawning. Diarrhea and piloerection, which is the hair standing on the skin. All right, thank you for listening.